Hello, I'm Anna and I'm an Ortho-Bionomy practitioner working in Ellesmere, North Shropshire in the UK. Many people suffer from lower back pain and I'll be showing you a variety of simple exercises that you can do to help relieve any pain and tension in your lower back. Lower back pain can be caused by a number of different things, so it's important that you choose which exercises feel right for you and for your back pain. Now, in the Ortho-Bionomy, we move and we hold the body in the free direction, where it feels at ease, where it feels most comfortable and has the least pain. And you can imagine that in this position of least pain, the muscles and the soft tissues are as relaxed as they possibly can be. And in this state of relaxation, they can begin to reorganize themselves. And it's very important that we remember this basic principle, that we always move in the free direction, the direction of least pain. The back, or the spine, sits on the pelvic ring. And many causes of lower back pain are because the pelvis, the hip bone, is either twisted or the pelvis is misaligned. So the first exercise that we're going to do is going to be checking the twist of the pelvis. So what we need to do is to sit on a chair, preferably a hard one, not a soft one. And what we're going to be doing is pushing one knee forwards and backwards and the other knee forwards. And in doing so, we're getting a twist of the pelvis. So first of all, we test to find out which is our free direction, which is the position which is most comfortable for us, which is the position which has least pain. When you're sitting here, you may be aware that your knees are not at the same length, not at the same level. So you may actually see, looking down, that one knee, it looks as if one knee is slightly further forward than the other knee. And by me, it looks as if my left knee is sticking a little bit further forwards than the right one. But we're going to test the direction anyway. So the first thing I do is push that left knee forwards and the right knee will automatically come back and I get the twist of the pelvis. And I see how that feels for me. And then I come back to the centre. And then I push the right knee forwards and the left knee will come back and I get a twist of the pelvis in the opposite direction. See how that feels? That doesn't feel quite so easy for me. So as my knees are already showing me, it feels more comfortable for me to push my left knee forwards. So what I'm going to do is I'm going to go into that free direction, into that position of ease. And what you need to do is to go into your position of ease, in the direction which you feel most comfortable. So I'm going to push my left knee forwards and go into that twist. The right knee comes back and I hold that for 10 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10. And then I come back to centre. Take a nice deep breath. Take a 2 to 3 second pause. Recenter myself. And then I'm going to do that again. So I push my left knee forward. You push forward the knee which is most comfortable for you. And I hold that for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. Come back to centre. Take a 2 or 3 second pause. And then do that one last time. So my left knee goes forward. My right knee automatically comes backwards. And I hold that for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. Come back to centre. Take a deep breath, maybe wiggle my back a little bit. And now I can gently retest. So first of all, I can look at my knees, which are now the same length, same level rather. My thighs appear to be the same length. My knees are level. And I can retest. So I know I go push the right knee forward and see how that feels. And that feels a lot more comfortable for me, which is excellent. The second exercise that we're going to do is going to be a tip of or a tilting of the pelvis. And what is useful, if you put your hands on top of your hip bones, so you've got them, you can feel them solid underneath your hands. And we're going to tip the pelvis forwards, so those hip bones will come forwards, and we're going to tip the pelvis backwards. It helps here if you also are aware of your tailbone sitting against the chair. So when you tip your pelvis forwards, the hip bones, your hands come forwards and your tailbone moves backwards. And then we come back to the centre and your hip bones go backwards and your tailbone goes forwards. We'll do that once more, and this time concentrate on which way, which direction feels easiest, feels most comfortable, and that will be our free direction. So we test, we tip the pelvis forwards, our hands go forwards and the tailbone goes backwards. We come back to centre and we tip the pelvis backwards, so our hands go backwards and the tailbone goes forwards between our knees. And we come back to centre. And for me, it's the direction where the pelvis goes forwards, which is my free direction, where I feel most comfortable, which exaggerates the small of my back, the arch that I have in the small of my back. So you now need to decide which direction feels easiest for you, and then we go in that direction, hold it for 10 seconds, have a pause, and repeat that twice more. So I'm going to push my pelvis forwards, exaggerate that arch in my back a little bit, not to the full limit, but just hold it about just over halfway, and hold that for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. Come back to centre. Take a couple of second pause, and then do that once more. So my hips go forward, my hip bones go forwards. I hold that position. 3, 4, 5, 6, 7, 8, 9, 10. Come back to centre. And one last time. My hip bones go forwards, yours might go backwards. Hold it. 2, 3, 4, 5, 6, 7, 8, 9, 10. Come back to centre. Sigh, centre myself. Maybe give myself a little wiggle. And then I can test. So now I'm going to tip my hip bones backwards. That didn't feel so comfortable for me. Ooh, and that feels nice and easy. And I can get back a lot further than I could before. So again, I freed off some of the muscles there in my lower back, which will help to relieve any pain that I may have had. You can do the pelvic tilting exercise when you're on your hands and knees, if that's easier. So you can tilt your pelvis forwards by bringing the tailbone upwards and the hip bones down towards the floor. Or you can tilt the pelvis in the other direction by bringing the tailbone down and bringing your hip bones up towards the ceiling. Try in this position to keep your upper back stable, because otherwise if I take the tailbone down and the hip bones up and I keep going, I can bring the upper back in as well, which might be a lovely thing to do, but isn't actually concentrating and focusing on just the pelvic tilt. So in this position, you need to test to see which direction of pelvic tilt feels most comfortable for you, feels most easiest or the least painful. Either tilting the pelvic backwards, so taking the tailbone down and the hip bones up, or the other direction, bringing the tailbone up and the hip bones down towards the floor. And then choose your free direction, hold that for 10 seconds, and then after that 10 seconds come back into the neutral position, hold for a couple of seconds, and then repeat that twice more. If you prefer, and it's more comfortable, you can do the pelvic tipping also lying flat on your back on the floor. Again, the same principles apply. You can tip your pelvis forward and creating an arch in the back, or you can tip the pelvis backwards by pressing the small of your back deep into the carpet, into the ground. Again, choose the direction which feels most comfortable for you. Hold that position for 10 seconds. Come back to the neutral position for a couple of seconds, and then repeat that 2 times. Another exercise which is a nice one to do to help relieve and relax all the muscles and soft tissues in the whole of the back area is an exercise which I've taken from the Feldenkrais method.
Again, if you're lying flat on your back and you're thinking of, again, tipping that pelvis to the tailbone and pressing the small of your back in, and you're concentrating on the whole of your body being as relaxed as possible. And as you tip that pelvis, watch what happens to the rest of your body. For example, watch what happens to the upper back. Watch what happens to the neck and the head and the movements that they might be making. And you can repeat that exercise for 5 or 6 times and then stop. And when you've stopped, if you lay down your legs flat by flopping one leg out to the side and sliding the foot along the floor until the leg is flat, flopping the other leg to the side and sliding the foot along the floor until it's flat. And then just stop and have a look inside your body. How does the back feel? Maybe the small of your back now lies flatter on the ground. Just another way of relaxing those muscles in your lower back. And otherwise, just keep doing that exercise just to keep relieving and releasing those tense muscles. Another way of helping to relieve pain and release tension in the muscles of your lower back is to lie flat on the floor with your feet on a chair, so that your legs are vertical. And again, in this position, you can just hold it for as long as you like, 5 to 10 minutes or even longer. As long as it feels comfortable, just stay there as long as it feels good.
There's a big muscle in the back called the psoas muscle, which can be the cause of a pelvic misalignment and therefore lower back pain. The psoas muscle runs from the lower vertebrae of the spine diagonally through the pelvis to the inside of our leg, and it's the muscle which we use to raise the leg, but also when we're under emotional stress it does tend to contract and shorten. If it does that on one side or the other side, that is enough to cause a twisting and a misalignment of the pelvis, which can then cause lower back pain.
And again, in this position with your feet on the chair, you can use this position in order to test and also to help release the psoas muscles. And the way that we do this is to bend in one direction and then the other direction. So I'm going to bend in this direction and see how that feels. Come back to the center and then bend in the other direction. That feels easier. So I'm just going to stay in this direction. And you stay in this position for up to 5 minutes. In this relaxed position, the psoas then, which will be tightened on this side, has a chance to let go and relax. And with a little bit of luck, when we come back to the central position again, it will feel easier to bend round to the other side. So I'm going to stay here for 5 minutes, a couple of minutes. And during that time, you may find that as the body begins to release, as the muscles begin to release, you might like to adjust your position a little bit, and that's fine. So just make sure that you're comfortable all of the time. Stay there for 5 minutes. And when that 5 minutes is up, we'll come back to center ourselves, and then we can test the other side to see whether we're able to bend more freely in that direction now.
Another cause of lower back pain can be if the SI joints, the sacroiliac joints, are blocked. And you'll find these joints along these lines here. Basically, they're the joints which join the hip bone and the sacrum at the bottom of your spine. If you put your fingers, no, your thumbs, on top of the hip bones and bring your fingers round to your back, your middle fingers will land on two bony prominences, and the joints between the hip bones and the sacrum run from just on the inside of these bony bits downwards towards your tailbone. If you have pain in any of those areas on either side, it's quite likely that your sacroiliac joint will be blocked, which means that you will have pain bending forwards, getting up off a chair. This pain can be quite excruciating, and I'll show you a couple of exercises that you may be able to use to help relieve a little bit of that pain.
One very simple way of helping to relieve and release any tension in those SI joints is to lie on your tummy with your head wherever it is most comfortable, and raise one leg, raise one foot, bend the knee, and just wave that foot around whilst focusing on the pain, the tension, how your SI joint feels. And as you move that around, wave around, it will help to relieve and release and move those tensed up muscles. Again, only do this if it feels comfortable for you. And then you can put that leg down, you can bring the other leg up. Maybe that side feels more comfortable. Whichever side feels most comfortable, then start with that leg. And if it feels okay, you might like to bring both feet up and play with those, but be very careful of your back. It's probably best just to leave it with one leg. And play around with that for as long as you would like, as long as it feels comfortable. A second method of releasing and helping to relieve pain in the SI joint is the frog leg. For example here, if I had pain on the left side, in the left SI joint, I would be moving the right leg. If I have pain in the right side, I would be moving the left leg. So you take the opposite leg to the side that you have the pain in. Here I'll show you for the left pain, if I have pain in the left hand side, what I'm going to do is I make my head comfortable and I bend my knee of the opposite leg, leaving the foot on the floor, into a little bit of a frog leg. This brings a compression into the SI joint on the opposite side, so on the left side for me, which helps to relieve and release any muscles and tension in that joint. And I can stay in this position for as long as I like. It's also a good position to go to sleep in if you're unable to sleep because of the pain in that SI joint. But again, only stay there and only do this if it feels comfortable for you.
Sciatica is where the nerves which come out of the lower back and then go down the leg get trapped. Depending on where the pain is down your leg, we can tell, that gives us information about which nerve is trapped. The main cause of these nerves becoming trapped is a misalignment of the pelvis. If you suffer from sciatica, these simple exercises may help, but they may not. If in that case, it really would be highly recommended that you seek out a therapist or an Ortho-Bionomy practitioner, of course, somebody who is able to realign your pelvis and thus release that trapped nerve and hopefully free you from some or if not all of the pain. These are very simple exercises which follow the principles of the Ortho-Bionomy, and they can be very effective in helping to relieve pain, including lower back pain. However, as with all self-care, they do have their limitations. With these techniques, we may only be treating the symptoms of the pain and not getting at the cause of your lower back pain, which from my experience very often comes from a misalignment of the pelvis. So it's always advisable to have a full treatment with preferably a qualified Ortho-Bionomy practitioner whenever possible. And you'll find more information about me and where I work on my website, Ortho-Bionomy UK. Maybe see you soon. Thank you.